My name's Thomas Tu, and I am going to talk to you a little bit today about why you should apply for the SCAI ELM Fellowship. I had the pleasure of being one of the ELM Fellows in the inaugural class of 2010. I'm a private practice cardiologist. I have been in practice for about 10 years in Louisville, Kentucky. And in my practice, I do a lot of general cardiology. I do a lot of interventional cardiology. I do peripheral procedures. I do structural heart disease intervention. And of course, I was looking for something more to do because I just didn't have enough. Just kidding. The ELM Fellowship really presented itself as an opportunity to get more involved in my profession. I think that I spent a lot of time early in my career building my practice, developing relationships with my partners, with my referring physicians, and spent a lot of time investing in what it takes to be a successful private practice cardiologist. And a lot of private practice cardiologists do not think that the ELM Fellowship or participation in SCAI is something that is very meaningful to them. And I want to make sure you understand that that's exactly not the case. Really, participation in our professional organization, SCAI, has been one of the most important things in my career because we are now in a situation in which there are a lot of forces that are affecting what we do on a daily basis. You know, it's no longer the individual's relationship between doctor and patient that decides what kind of care the patient gets. There are things that are involved in Washington. There are things that are involved from local coverage guidelines, from your insurance companies, from Medicare. All of these things, hospital regulations, appropriate use criteria, these are things that affect us on a daily basis. And participation with our professional organization is one of the ways, first of all, to be educated in these things and to understand how these factors affect us. And secondly, to take a leadership role in affecting change that will help our patients first and foremost, and then us as interventional cardiologists. I've been very lucky to have been an ELM Fellow for 2 years. ELM stands for Emerging Leadership and Mentorship, and those three things are very important factors in this program. Emerging, we're looking for young, motivated people. Okay, not a lot of gray hair here, but a little bit. And we're talking about people maybe within their first 10 years out from fellowship. These are people, I think, with the vision and the energy to really become the leaders of our profession in the future. Number two is leadership. And we're talking about people that want to not only build something for themselves, but to help our patients and to help our profession move into the new era. And then lastly is mentorship. And that's something that is one of the fundamental parts of this program, is that it's an opportunity to meet and to develop relationships with peers, with people from all over the country, with people more senior, less senior, and to really get a feel of the community of interventional cardiology. And the ELM program has been wonderful in helping get me established in that regard. I've been a very active member in SCAI ever since participating in this program. I have taken an interest in public relations, in advocacy. I've had the chance to go to Capitol Hill and meet with our congressmen and senators about healthcare change. I've had a chance to participate in writing some of the guidelines in terms of the consensus documents regarding the care of interventional cardiology patients. These are all things that certainly could have been possible without the ELM Fellowship, but the fellowship made it much easier. Part of it is what the program can do for you, but part of it is it gives you the responsibility, and the onus is on you as an awardee to give back to your profession. And I think it's very important. So my main recommendation for you is to think strongly about supporting your profession. Most of us in interventional cardiology are in private practice, and this organization represents us, and we need to take charge of it and be leaders. And make sure you apply, make sure you take an interest in your profession. And you know what, even if you do not get selected as an ELM Fellow, I can tell you some of the best people who participated in SCAI are people who applied and did not get awarded the fellowship and yet still participate in all the activities and get all of the benefits. So good luck, and I hope that you have great success in your careers.